So Jack, what are your nursing goals as a new graduate?
So, as a new graduate, in reading the literature, I found that many new graduates find it difficult and suffer from somewhat of a reality shock when they realise the multiple responsibilities and accountabilities that they must take on. These responsibilities vary from being clinical, obviously, all the way to being interpersonal, professional, interprofessional, etc. I want to familiarise myself with these responsibilities and accountabilities, understand these, and then in doing so, hopefully being able to enact them in an appropriate way whilst I'm practicing as a new graduate nurse.
Okay, good. And as a leader, what are your future goals?
So, as a new graduate nurse, and whilst I was on placement, I always viewed leaders, clinical leaders, as senior staff that have had many years of experience, very proficient at their craft, very proficient at skills, etc. However, in reading the literature and really understanding leadership, it seems to be more of a spectrum of skills that one must attain. So these skills can be openness, being a good communicator, being good at delegating skills, etc. And I believe that if I focus on these developmental building blocks, then in time I can augment these and become a proficient clinical leader.
Okay. And as an educator, what are your goals?
So, in terms of education, I always think back to when I was a student. What made one nurse that I was with a good nurse, and what made a nurse that I was with a bad nurse? And I want to take that sort of experience and take on students in my first year when I feel comfortable, obviously. I want to create a philosophy of positive reinforcement and effective education, and hopefully provide those students with a formative and positive experience that they will have with me, that will shape their future academic career.
Good. And as a manager, what are your goals?
So, as a nursing manager, I feel that quality improvement is a key managerial role. Ever since day one of my university course, I've been fascinated with clinical research as a method of improving patient safety, as well as improving the effectiveness of care, not only in the effectiveness of treatment, but other factors such as cost savings and things like that. I believe that if I focus on my future career in research, I can improve the quality of care which is given to Australian citizens and other citizens in healthcare.
Thank you.